Curious about the latest in facial rejuvenation? Join Dr. Patrick Flaharty for a free educational seminar at Azul Cosmetic Surgery and Medical Spa, discussing non-surgical facelift, laser facial rejuvenation, modern facelift, and more. This anti-aging seminar series starts at 6 p.m. on March 6th in Fort Myers, March 8th in Bonita Springs, and March 12th in Naples. Meet Dr. Flaharty and ask questions after the seminar and receive a free consultation. Reserve your seat now, 239-415-7576, azulbeauty.com.
Good morning, and welcome to Look and Feel Your Best with Dr. Patrick Flaharty. I'm Gina Burch. Dr. Flaharty is the medical director of the Azul Cosmetic Surgery and Medical Spas in Fort Myers, Naples, and Bonita Springs. And every week we get together and talk about ways that you can look better and in turn feel better, because what you have on the outside and inside are harmonious. Can we use that word?
Harmonious, yes. Yeah, a little teaser about what we'll talk about today. But, you know, it's funny you say that, because I just this week had a patient say, we were talking, she was post-op and looked great. And she's like, yeah, I'm really happy with how I look. And it just makes me feel better. Looking better just makes me feel better. And I hear that a lot, which is really fun. So obviously that's the name of our show, Look and Feel Your Best. Because it does go hand in hand. It does make a difference. Right. You know, is the way you look the most important thing in the world? Of course not. But I mean, I think when we look better, we do feel better about ourselves in general. And
where you come in, you turn back the hands of time quite a bit on people's faces and their skin, not just the skin on their face, but other places and body contouring and all kinds of stuff. But a lot of people feel young on the inside and feel a different age than what is on paper and what their physical appearance would give away.
That's right. And, as things are changing, we are living longer and staying healthier and working longer and staying socially active longer. But unfortunately, our external appearance doesn't always hold up as well as maybe our internal. Like you say, a lot of people feel really good intellectually and spiritually and physically. They may be really, really in great shape. And there's a little bit of two-edged sword there. When you're super fit and lean and don't have a lot of extra body fat, your face tends to look a little older because it will be thin too. So and I hear that every single day. People say, gee, I feel great and I'm working out and I'm feeling the best I've ever felt in my whole life. I've got, they feel like they've got it all together.
They walk by a mirror.
Right. And they're just, wishing that their external appearance sort of matched the way they feel. And, that's an important motivating factor for a lot of people coming in looking for some cosmetic improvement.
Right. One of the things that you do, and, we were joking around with the word harmonious here when we opened the show. But one of the things that a term that you use quite often in your practice is harmonious rejuvenation. And we're going to talk a little bit about that this morning. And, for the last couple of weeks, we've been taking chapters from your book, Young Again. It's your newest book. Yes. And you've really are targeting the baby boomers with this.
Right. Yeah, it's just published in October, November. We finally got the first copies, and it's available on Amazon as well as in our offices. And, it really is Baby Boomer's Guide to Facial Rejuvenation. I had written a previous book called Look Younger Now, and that was, 5-6 years ago. And since that time, a number of new technologies and new procedures have come to the fore. And it was interesting, within a year or two of publishing the first book, there were things we were doing that weren't in the book. That's how quickly this changes. So now, again, there's a number of items. And so we, wrote a second book that, obviously has some of the same topics, but updated versions of the same topics and a number of new topics in there as well.
So Harmonious Rejuvenation is not a chapter in the book. So if you've got the book and you're like, I'm looking for this so I can follow along with you guys, and I don't see it. Rather, it's more of a theme, and it's something that is mentioned probably in multiple locations. But it's an underlying theme of what you do here in the office and of all of the things in the book. So tell us, let's focus on that and tell us about I guess theme, maybe philosophy would be even a better word. It's kind of your philosophy too, right?
Right.
Yeah.
So the concept of harmonious rejuvenation means doing things in a way that blend together in the best possible way cosmetically. And I use it primarily as applied to surgery, but you can really actually use it for non-surgical things like fillers, for example. An example with fillers would be, we're doing a lot of fillers to reestablish volume in the face. People lose volume with age, and we lose fat from our face as well as muscle and bone, and our faces really become more hollow with age. In addition, you get sort of stretching of the skin and sun damage, and so these are all the things that we start to see in the mirror with lines, creases, and hollows, dark circles. One example would be, for example, using fillers to volumize the cheeks, which is a fantastic treatment and an easy thing to do in the office, and makes everybody look younger and healthier. And if a patient is really, really thin and we add a filler to the cheek and rejuvenate the cheek, but they also have really hollow temples, for example, you can see this sometimes in patients who've had multiple treatments for the cheek to help give him or her fuller cheekbones and fuller cheek area, just this full, more youthful shape, but a really hollow temple. And so there's a kind of a mismatch there. The temple doesn't match the cheek. And so for those patients, the ideal way is stop filling the cheek because you've already got that corrected, and start filling the temples so that those can blend in and it looks like it belongs together. There's not like a mismatch.
Yeah, because one of the things that you pride yourself in here at the Azul Cosmetic Surgery and Medical Spa is a natural look. And when someone looks at you, they're like, something's different. And it's not, and it does, like you said, it doesn't blend. It's not flowing. And it might contribute to one of those when people say, I don't really look natural because I just had one thing done. And now it stands out. And the other thing that's not good stands out. And you know what I mean?
Yeah, so there's a couple of things that can cause you to look unnatural. And that's everybody's biggest fear.
Right.
That's the biggest fear of surgery or even non-surgical rejuvenation. And one would be doing, like for example, with fillers, overdoing them. Cheeks that are too big, they become too big for the natural shape that they should be. Obviously, there's a lot of individual variation, but at some level it becomes, almost noticeably abnormal.
Right.
And you don't really want that. And lips would be another example. When we talk about lips, patients are usually very hesitant at first because they've seen patients who, you can remember from Goldie Hawn from the First Wives Club, but you see patients like that in when you're out and about who've just really overdone their lips.
Looks like ducks.
Yeah, they just don't look normal.
Right.
I mean, they're not normal. You have these overinflated lips. So the idea is to reestablish a youthful healthiness, and with our lips, they can shrink a lot with age and become more wrinkled and less visible and kind of almost shriveled up. And adding a little volume can make them look fuller, softer, and more youthful, which is great. Adding too much volume can create an abnormal looking lip that doesn't match the rest of the face or just looks abnormal. And that can be in terms of shape or size. So there's a lot of subtle things. And preserving natural anatomic limitations is sort of a key factor there. You really want to make sure you do things to help people look their best naturally, but not different and not unnatural. And that's very achievable with really good aesthetic judgment. But harmonious rejuvenation speaks to doing things in a way that blend in. And, for example, in surgery, sometimes patients will come in and just say, I hate my neck and I just want a neck lift. And, most of the time they'll need a face and neck lift together because those tend to age at the same rate. That same patient may have heavy eyelids or a droopy eyebrow. And if they say, I don't really care about that, I just want my lower face and neck done.
Because that's all they can see and that's all they want.
Well, that's their number one touch point. That's what really bothers them, right? So you do that, and the lower face and neck look great. And then guess what? When they look in the mirror, they don't notice the lower face and neck anymore. They notice the heavy eyelids or the heavy brow. And, that creates, again, a mismatch where the lower face and neck looks really good and the upper face looks a little bit tired because of heaviness of the brow or heaviness of the lids. And that's what we call disharmonious. So the concept is to try to do things in a way where they all blend in, where everything looks the same. And we don't always age at the same rate in every single part of the face, of course. So it has to be very individualized. But if you've got a heavy lid and a heavy brow and a heavy face and neck, and you just do one of those, then the other two are going to stand out even more noticeable afterwards. And we always use the analogy, it's like redecorating a room and leaving an old chair. That's the first thing you see when you walk into the room because it stands out. It doesn't fit with everything else. And so that's another part of having a natural rejuvenation, is having everything blend together. It's really true that in a surgical rejuvenation, or even non-surgical if we're doing fillers, kind of the more you do, the more comprehensive the treatment, the more natural you look. And sometimes that's hard for people to understand, but it's true, because if it all looks really good and it all blends in, it looks natural and you look really great. And there isn't anything that stands out. So by eliminating sort of all those visible aging changes, you not only have a great result, but a very natural result. You still look like yourself. You look just naturally refreshed and healthier.
And that can be a little bit overwhelming to some people. Like, oh, well, I just thought I needed my neck lift, and now when I come to the consultation, now I see these other things, but that's part of coming in for a consultation, because then you can kind of map that out and come up with a master plan.
Yes, that's right. And the idea in a consultation is to look at, there's so many tools we have now, non-surgical, lasers, injectables, skincare, topical treatments, as well as surgical treatments. So we have a huge number of options. And I think once we do the analysis of the face and neck and look at everything, we can then come up with a list of options for the patient that will, that can help. Everything from skincare to, some light lasers in the office with no downtime, to injectables, to surgery. And, almost everybody gets a combination of multiple things, because there's, so many things we can do. The patient really is, guiding the direction of the ship. Of course, they're going to decide what makes sense for them and at what time frame. And that's another important point. Obviously, it doesn't all have to be done at once. You can start with skincare and fillers and those types of things. And then as you see the effects of that, you can add a little bit more. And that's what most people do, just because that's the easiest for them to kind of, dip their toe in the water, see how it goes, try a little more if they're happy, and kind of build up. But when it comes to surgery, you are blocking a certain amount of downtime. And so it does make sense to get everything done that needs to be done. It's easy to pop into the office, once a month or, once a quarter and have some injection or some kind of skincare and then go back about your activity. But it's not as easy to come in, twice a year for a surgical procedure. So when we look at surgery, we want to make sure we make the most of that opportunity. And we can get a little more into how that works. Yeah,
I've got some questions, and maybe you can bust a few myths about what you were just talking about here when we come back. But let's take a quick break, and we'll be back with more of Look and Feel Your Best with Dr. Patrick Flaharty. I'm Gina Burch.
Nothing says I love you like laser beams. Okay, no one has ever said that, but at Azul, it's totally true. Azul offers in-office laser skin treatments so you and your loved ones can enjoy healthy, radiant skin all year round. Laser skincare treatments are perfect to remove sunspots, minimize wrinkles, improve skin texture, and tighten the deeper layers of the skin. Save now, as every cosmetic laser treatment at Azul is 10% off. Plus, you'll receive $50 towards Botox with all laser packages. Call Azul today or visit azulbeauty.com.
Curious about the latest in facial rejuvenation? Join Dr. Patrick Flaharty for a free educational seminar at Azul Cosmetic Surgery and Medical Spa, discussing non-surgical facelift, laser facial rejuvenation, modern facelift, and more. This anti-aging seminar series starts at 6 p.m. on March 6th in Fort Myers, March 8th in Bonita Springs, and March 12th in Naples. Meet Dr. Flaharty and ask questions after the seminar and receive a free consultation. Reserve your seat now, 239-415-7576, azulbeauty.com.
Welcome back to more of Look and Feel Your Best with Dr. Patrick Flaharty. I'm Gina Burch. This morning we're talking about the concept, the philosophy of harmonious rejuvenation and how that works in the office here at Azul Cosmetic Surgery and Medical Spa, and how it works when when you come in for a consultation and Dr. Flaharty looks and says, okay, well, I know all you see is one thing wrong. And not that anything's wrong, it's just how you are. You're beautiful the way you are. We all know that. But there are things that you want to improve upon. So we were just talking about how it makes sense to do everything at once for a lot of reasons. number one, it looks more natural. You don't have something that stands out like the old chair in the corner when you have all this fresh paint and new carpet and drapes, and there's something that's standing out that doesn't fit in. But the question I was thinking when we left off from the last segment is there's probably a perception from some people who are a little afraid to begin with, not sure what they want to do, that, oh my gosh, I can't do all that at once. I'm never going to heal. It's going to hurt. If I do 3 things, I just need to do one thing at a time, because how's my face going to heal? Just doesn't seem right.
Right, and that's a common concern. As I mentioned, I think patients' biggest fears are looking unnatural, and then, of course, fear of surgery, having discomfort, and those kinds of things. But as we were just getting into in that last segment, we talk about harmonious rejuvenation with respect to surgery. It makes the most sense when you're doing surgery to do all the surgical things that you need to get done at once. The reason being, you have one surgery, one recovery period, and then you're done with it all. And, it's, sometimes people think, okay, well, my neck just really bothers me. I just want to start with my neck. And I see that my eyes are heavy and maybe my brow is heavy, or maybe my skin needs some rejuvenation too, but I just don't want to do too much. I just want to do that. And of course you can do that. That's, again, the patient's driving the ship, so they can make the decision that makes the sense, whatever makes the most sense. Much quicker, much safer, much more accurate in all that we do. And the downtime, when you think about the downtime from eyelid surgery, for example, which is a relatively small procedure, you will have some swelling and discoloration around your eyes for a week or two. So there's some visible signs of that for a couple weeks, sometimes even longer. If you do weeks of downtime. So the downtime, it's overlapping. So, if you do 5 things versus 1 thing, it doesn't make the downtime 5 times worse, or the discomfort 5 times worse. You've done more procedures. Sure, you might have a little more tight, much different at all.
Right.
Almost everybody is still out and about by 2 weeks, if not sooner, even if we do everything at once. And then the beauty of that is you have one surgery, one recovery period, and you're done. Everything looks good.
Right.
So in my mind, I look at surgery as a one-time only event. We're going to, and again, obviously this is very individualized, but for somebody, 50s, 60s, 70s, who's got, kind of aging changes where, there's some heaviness of the brow, lids, face, neck, some hollowness, then doing a rejuvenation, what I call 3-dimensional rejuvenation, which we'll talk about, where we do the brow. And you can do all that now because we have better technology. Surgery is less invasive. Anesthesia is safer. Recovery times are less. So in the past, we wouldn't combine so many procedures at once. Now we can safely do it. Which is a huge advantage for the patient. And the other thing, there's some economic advantages too, obviously. And once you're in the operating room, if you're paying for anesthesia and OR time, it's a lot easier for us to do 5 procedures in a row versus do 1 or 2 and then come back later and do 1 or 2. You pay for that upfront fee to be there, and so you
take advantage of it. I'm in. You're not kicking me out till I get everything done.
Right. Yeah, you save time and you save money, and so that's the ideal way to do it. And again, we obviously individual is important for the patient. Those get weighed in. Our job is to lay out all the options. But in a perfect world, doing all the surgical things at once is best, and that's what a lot of patients, the majority of our patients do decide to go that way because they realize it does make sense. And once they've carved out that time, those 2 other procedures.
No, because I want to go on a vacation next year.
Exactly.
I want to get out of town. I don't want to spend it recovering.
Right, exactly. So the Harmonious thing really deals with helping you look your best. I mean, that's the key to it, so that everything. There are other benefits to doing things this way, which are, obviously saving time, saving money with regard to surgery. It's not as difficult to do a little bit at a time when we're talking about office procedures like fillers. If we're doing a series of Sculptra treatments to build up collagen to help, fill in hollows and make the face look younger, or other types of injectables, and then adding in some skin care, some micro-channeling with growth factors, or hydrofacials. Those things you can kind of chip away at because you don't have downtime and you don't have to pay for the anesthesia and facility. You basically can just come in at your leisure and do what you want, and so it's it's an easier way to do it. Although obviously we still want to do things in a harmonious way when we're doing Botox fillers and these office-based procedures. But that's, a little bit easier to go a little bit at a time. But when you're talking about surgery, if once you've decided you're going to do that and you carve out that time, then looking at it from the standpoint, okay, how can we maximize the opportunity? How can I get the most out of this procedure? And that usually entails doing a number of things together to give you that maximum benefit, and not leaving one or two things undone, which are going to be the things you see in the mirror. And from experience, I've been doing this over 20 years now. That's what the patient will see, and that's what they'll come in and go, I love my neck, but, you're right, my eyelids just look heavy, or my brow seems heavy now. And because it won't match, and it'll be more noticeable afterwards. So anyway, that all comes down to just good planning and good aesthetic judgment in what we're doing. But that's a key to really, really good results, having patients look their best and look natural.
So when we're considering facial rejuvenation and we're specifically talking about surgical procedures now, what are the main categories when you look right down into what to do and how to make it all work? Yeah,
so when we do a consultation, first thing I do is, look at the photos with the patient and have them point out the things that bother them, because obviously that's, really important to understand what they're seeing. Then the second part is really just doing a comprehensive exam on the whole face. So even if it is just the neck that they really are bothered by, you want to look at everything and kind of show how that all works and how they are all interrelated. Because again, on the face, everything is interrelated. So you can't just treat something in isolation, because that's going to affect the adjacent area, right? Mm-hmm. So it has to be looked at globally. Even if you're only doing part of the face, you need to look at the other parts of the face to see how it will all work. And so much of the aging change is volume loss, and so that loss of volume, is something we have to look at and talk about and, address that. But I start at the top of the face and work our way down. So I start with the brow and assess, the position of the brow and the degree of laxity. And then the eyelid, and upper eyelid obviously is intimately related to the brow. Sometimes people look like they have a very heavy upper eyelid, but when you correct the brow, all of a sudden there's no, there isn't any extra skin there. So it's mainly brow drooping. And so that we look at and decide, how much of this is, the brow versus the upper eyelid. And then, lower lid, mid-face kind of is another sort of aesthetic area. Lower lid, you could have extra fat, you could have wrinkled skin, you could have dark circles. Mid-face, often we have some degree of hollowness or deflation there where we've lost sort of our youthful cheek area, and that's typically a volume issue that can be addressed with either fillers or fat augmentation. And then we work our way down to the lower face, and that kind of breaks down into the perioral region, the areas around the mouth, the lips, and the mouth. And that's obviously a problem area for almost everybody as we age, because you start to get frown lines and, vertical lines on your upper lip, and the lips deflate, and we get some creasing and folding around the mouth. When you think about it, there's so much movement of the mouth. There's always lines, creases that are formed from smiling and speaking. And those things, we do every day. So those creases, when they start to appear, are going to only get deeper and deeper as a result of that movement. So we'll look at that and, again, talk about how we treat those, whether that be with fillers or with laser resurfacing or dermabrasion or something to tighten up that skin. And then lastly is, the lower face and neck, the jowling and the neck laxity. And that's sort of a composite area that, typically is rejuvenated at the same time. And a lot of people come in saying, I just need a neck lift. But, you look at the face and it's all kind of aging at the same rate. They just notice the neck because the skin is so much more visible there, even though the skin of the jawline is loose too. So for primary lifts, which means the first time you've had a lift, you almost always have to do the face and neck together so that it looks, again, harmonious. You're not going to tighten the neck and make that look tight when the jowls and the cheeks are really loose. That just, again, won't look right. It'll look disconnected and look unnatural.
And I know you wanted to talk about this a little later, but I'm gonna throw it in, and we can go into detail a little more as well. But when you're talking about the rejuvenation, so then we're tightening all this, but if our skin still looks spotty and sun damaged. I mean, so when does that come in as well? So now my skin is looking tight. I've got, some fullness back, but gosh, I've still got all those brown spots and age spots and,
Yeah, well, the skin comes in right away. And part of the initial analysis, we will look at the skin and determine where that's at in its aging. And, some patients are, really good about taking care of their skin, and the skin looks beautiful even if they're in their 70s. They haven't had aging. And obviously a lot of that can be based on genetics and how much sun exposure you've had, but general skin health can make a huge difference. And then, we'll have a series of options there too. I mean, you can do, most of the patients we recommend, they just, start with one of our estheticians and get started with skin care, which would be things like hydrofacials and microchanneling with growth factors and IPLs to get rid of the browns and reds, and maybe some micro peels and a number of things to stimulate new collagen, get rid of the red and brown spots, to tighten up the skin, get rid of fine lines and wrinkles. And those things can work wonders. It does take a little bit of time. That's not an instant improvement, but you get a little bit of benefit from each treatment, and it builds up over the course of a number of months. And that's nice because there's no downtime. We do have more aggressive approaches like laser resurfacing, where you can get a brand new envelope of skin within 2 weeks, but that obviously is surgical and has some downtime. You're basically taking off the old skin and allowing a new layer of skin to heal in. And that's a technique. We'll talk a little more about that. It's improved a lot with fractional lasers and the ability to adjust the energy levels so that we can get the rejuvenation we want with less downtime. But everybody has some downtime, a minimum of about a week with that. But in those cases, for people like, I just want the best result now, I don't want to work at it so hard, laser resurfacing can get you there very quickly,
right.
Just a single procedure.
Okay.
So, yeah, we do look at the skin and discuss that as well. That's factored into this.
Right. And if your skin is healthy, when you go into surgery, it's going to make you heal a lot quicker as well.
You do look better, yeah.
Right.
It's always nice to operate on patients who have really good skin because they look good right away, and it blends in more naturally.
Okay, let's take a quick break, and when we come back, let's break it down a little more. You've given us an overview, and let's talk about some of these specific procedures that you mentioned.
Let's do that.
All right, you're listening to Look and Feel Your Best with Dr. Patrick Flaharty. I'm Gina Burch.
Want the absolute gold standard of facials? Try the Azul Platinum Facial, the perfect choice for any skin type or sensitivity. How about the facial choice of many celebrities today? The Hydrofacial MD is the skincare procedure you want. If you want to minimize major skin damage accumulated throughout the year, microdermabrasion polishes and exfoliates the top layer, removing impurities and imperfections, revealing younger, firmer skin underneath. Call today, 415-7576, or online at azulbeauty.com.
Curious about the latest in facial rejuvenation? Join Dr. Patrick Flaharty for a free educational seminar at Azul Cosmetic Surgery and Medical Spa, discussing non-surgical facelift, laser facial rejuvenation, modern facelift, and more. This anti-aging seminar series starts at 6 p.m. on March 6th in Fort Myers, March 8th in Bonita Springs, and March 12th in Naples. Meet Dr. Flaharty and ask questions after the seminar and receive a free consultation. Reserve your seat now, 239-415-7576, azulbeauty.com.
Welcome back to more of Look and Feel Your Best with Dr. Patrick Flaharty. I'm Gina Burch. We're talking about harmonious rejuvenation when it comes to, mostly we're talking about surgery. We've talked about some non-surgical procedures, but specifically surgery today. And it's kind of a philosophy at the Azul Cosmetic Surgery and Medical Spa, and a theme in his new book, Young Again, even though there is not a chapter dedicated specifically to the three-dimensional rejuvenation and harmonious rejuvenation. It's still something that you address within the pages. Yeah,
it's a very important concept, and it's kind of spelled out in there in more detail than we're talking about today, and so that's a helpful read for those who are interested in that. And the book's called Young Again. It's a baby boomer's guide to facial rejuvenation, and you can get it on Amazon, or you can pick it up in one of our offices. But anyway, as we talk about harmonious rejuvenation, I thought it'd be helpful just to kind of walk through sort of what else, what's included in that. And obviously this is very individualized, so not everybody gets everything, of course.
Right.
You do, what's what's in the patient's best interest based on their desires and what they're looking to do. But in many cases, many of these elements will be combined into the procedure. So starting at the top of the face or the upper face, endoscopic brow lift. And these, we've spent time talking about these procedures in a lot of detail in the show when we've dealt with that. But kind of running through them sort of globally together. Endoscopic brow lifting is a fantastic new way. It really is an upper facelift, but it's done endoscopically. So what does that mean? That means you're not really actually opening the tissue. You're basically just making tiny little incisions, like 1.5 centimeters in the hair, up in the scalp, in the hair, so they're hidden. And through those small little incisions, you can actually put instruments in to release the forehead. And we use an endoscope too, which is kind of a very long, narrow instrument that slides through that little opening, and that can allow us to visualize. So we can visualize the inside of the eyebrow, the tissues, and as we release those from the bone. And so that allows us to be able to see what we're doing without having to open up the whole brow. And so that's what really endoscopic surgery is. It's more minimally invasive, using endoscopes to visualize the inside of the body so we can accomplish what we need to accomplish without having to make large incisions.
And I think that's a great point that you make for people who are thinking, how can I get everything done at once? Well, gosh, I just had my brow lifted and all you made were a couple little incisions.
Right.
So it's not as major as what you might be visualizing.
Exactly, yeah. So there's no, there's no tissue removed in a brow lift. We make typically 4 very small incisions hidden in the hair-bearing scalp. We use those as just access points to release the brow, make sure we get a symmetrical release. And then the brow is basically, lifted and reshaped because you can then slide the scalp up. And we hold it into place with a really unique device called an endotine, which is it looks like a clear piece of plastic. It's small. It attaches to the bone and attaches to the scalp and allows us to shape the scalp, shape the brow. And I usually will sit the patient up and we'll look at the sides and adjust them to make sure we get the right height, shape, and contour. Obviously, that can be very different for a male versus a woman. But the endotines allow us to get very accurate with the height, shape, and contour of the brow. It's been a huge advance. So now we have a minimally, invasive procedure in the sense of only small little incisions. No skin is removed. We reposition the brow and hold it into place in a very accurate way. And it just seals down and becomes stable in that position.
Amazing.
So it's a wonderful treatment.
Yeah.
And literally that treatment takes less than an hour. I mean, it can be 45 minutes or even less.
Wow.
It goes very smoothly. We do a lot of them, so we're very fast and efficient. But as you mentioned, less invasive, less downtime, quicker recovery, that allows us to do, more procedures at once and to be able to get patients through these procedures quicker and less recovery time.
So that gets rid of that heavy brow. And sometimes, like you said, that will automatically help the appearance of the eyes. But sometimes you might need a little bit more for the eyes, that just that lifting alone isn't enough.
Right. So in the preoperative assessment, we'll assess, and it's easy to do that. You can have a patient hold the mirror and show them what a brow lift will do. You can just lift it with your fingers and show them exactly, the height, shape, and contour you're going to achieve, or what's the ideal one. And obviously patients can have input because everybody has maybe different feelings about what looks best for them in terms of their brow height, shape, and contour. So patients obviously can are very involved in that decision making process. But during that exercise, you can determine how much of that loose skin of the eyelid will be resorbed, so to speak, when you lift the brow. You're basically, pulling the curtains up so there's less curtain, kind of on the floor, so to speak. And so then you determine whether there is still excessive skin of the eyelid or not. If there isn't, you don't need to do anything with the upper eyelid. That's just left alone, so there's no incision on the eyelid. So again, the incisions in the hair-bearing scalp for the brow lift are closed with dissolvable stitches that fall out in 2 weeks, so you don't even see those because they're kind of clear. If there is extra skin on the eyelid after you've lifted the brow, such that, it's just too much, the eyelid is still heavy or hooded, and we want to have reduce that fullness, then we will do a blepharoplasty or an upper eyelid surgery at that time. And typically, once I've lifted the brow, we will then assess the degree of redundancy, because obviously lifting the brow is taking some of that loose skin out of the way, so you're not going to have to remove as much skin. And so we measure that out and then, trim out that extra skin that still remains in the eyelid. And that closes with just a delicate little stitch. that comes out at a week's time, and that just it's right in the natural crease of the upper eyelid, so you really don't see that much at all.
Right,
Yeah.
and then that just takes care of that, and you look brighter-eyed and bushy-tailed. Well,
Exactly.
you don't deal with that part, the bushy-tailed.
But yeah, in somebody that's got a heavy brow and a heavy lid, they have a lot of hooding there. They're really heavy. It can give them a stern look or an angry look, certainly tired. When you lift the brow and take away the extra skin of the upper eyelid, then they're going to look really good. They're going to look refreshed. It eliminates a lot of the tired, angry, eliminates the angry appearance and just makes them look much, much better. So it has several really important impacts in helping people look better. Again, kind of that scowl look, that doesn't really help anybody.
Right. And when you lift the brow too, if we automatically get a lid lift, and maybe that's all we needed, does that help with the crow's feet as well? Can that help smooth out the side part of the eyes?
The brow lift really helps with that.
Everything?
Because,
Okay.
when the forehead drops, you can get deeper creases between your eyebrows. You can get a lot of hooding and heaviness of your eyelid, and it makes the crow's feet a lot worse. So a misconception is that you can cure crow's feet with eyelid surgery. You really can't, because that's really outside of the area of where we're operating. And so, that really requires a brow lift. But if you've got some looseness of the brow, it's going to spill into that, what we call the lateral canthus, that area where you have the crow's feet. So when you do an endoscopic brow lift, it tightens all the way down into the cheeks and even into the midface. And so that, corrects that problem. And again, that's something that's easy to demonstrate to patients with a mirror in the office.
It's a great procedure. So let's say that corrected, the upper part of the face, but then, oh gosh, my lower lids. My upper eyelids might be fine, but then like you're talking about, we want to be harmonious.
Right.
If everything looks good from the pupil up, but I've got the bags or the hollowness or, fat pockets.
Right. In the lower lid. So really, I break the face down into really three areas. You have the upper face, which is the upper lid brow, and we just sort of talked about that, endoscopic brow lifting and upper lid blepharoplasty. And then we have the mid face, which is kind of the lower lid cheek area.
Okay.
And so we want to look at that together. And as I mentioned, a lot of the aging changes in the lower lid cheek are volume loss and deflation. We lose fat, we lose bone. Our faces become more hollow. You start to get these dark circles and lines that you didn't have, shadows. Really, if you just look for the shadows, you can see a teenager has no shadows. They have this plump, full face that's all a convexity, and it reflects light very cleanly. As we get older, we get these hollow areas, and then you start to get shadows in the hollow. But the other specific things of the eyelid is, you mentioned you can have visible fatty pockets. Usually that's because the fat from the cheek is disappearing, and so it's exposing the fat that's always been there. But sometimes it can bulge a little more forward just based on loosening of some of the tissues. The fat starts to spread out and becomes more visible under the skin of the eyelid. Just like in the upper eyelids, the amount of movement of the eyelids can create redundancy, so you can get some loose skin in the lower lid, and wrinkling, and you see that a lot in the lower eyelid, that very thin skin with all the movement, blinking 20 times a minute, rubbing your eyes. Over the course of many years, you'll start to get some wrinkling and redundancy of it. And so there are specific procedures based on the contour, and again, this has to be very individualized based on what the patient has and what their goals are. But sometimes trimming out a little bit of that extra fat from inside the lower lid, what we call transconjunctival lower lid blepharoplasty, that's nice because you go inside the lower eyelid. There's no cutting of the skin. There's no stitches, so it's completely invisible. It's just done internally, and you don't even need an internal stitch. That heals on its own, the inside of the eyelid. And that can be used to remove bags from the lower eyelid if you have excessive amounts of fat there. And then the skin, there's a lot of different ways to deal with that. Sometimes we'll just take out a little skin called a pinch technique. Just a small amount of skin is trimmed out right under your lashes so that it blends into a natural crease. Sometimes we'll use just a gentle laser peel to tighten the skin, not actually remove skin, but just shrink and tighten it. That works really well. Or a TCA peel, which is like a medium depth chemical peel, which can tighten fine lines and creases. And so that can improve the contour of the skin. And then the dark circle and hollowness that we see in below the lower lid and into the midface area, we call the tear trough, and then midface. Those are areas where we'll often add volume to correct. And that may be the first thing we do, because if you fill in the dark circle under the eye and correct that, and you add volume to lift the cheek, that often will make the lower eyelid look a lot better because you've reduced the dark circle and you've hidden the bag a little bit by filling in the hollow, it doesn't stand out so much or at all. So sometimes we can eliminate the need for surgery just by doing volume into the lower lid.
And some of that volume in the cheek could help the appearance of the crow's feet a little bit too, because it just inflates your skin a little and just kind of it gets, like you use the example of a balloon,
right?
Blowing up a balloon. It's just saggy, and then you blow it up, and like, oh wow, all of the wrinkles went away.
Yes, that's right, and that's true. Fillers can definitely help with wrinkles by expanding the skin. You're filling it out a little bit better,
right?
And we can see improvements through the cheeks and even into the crow's feet area with that, and definitely in the lower eyelid. So, yeah, so lower lid, it's become more sophisticated because we're looking at revolumizing and creating a more youthful shape, not necessarily just surgical things. We want to really do addition more than subtraction if we can. Add volume back, give you more youthful volume, not make you more hollow.
Okay. I've got a couple more questions about the mid-face and the cheek, and then when we come back, let's talk about that in the lower face and neck.
Sounds great.
All right. You're listening to Look and Feel Your Best with Dr. Patrick Flaharty. I'm Gina Burch. We'll be right back.
Nothing says I love you like laser beams. Okay, no one has ever said that, but at Azul, it's totally true. Azul offers in-office laser skin treatments so you and your loved ones can enjoy healthy, radiant skin all year round. Laser skincare treatments are perfect to remove sunspots, minimize wrinkles, improve skin texture, and tighten the deeper layers of the skin. Save now, as every cosmetic laser treatment at Azul is 10% off. Plus, you'll receive $50 towards Botox with all laser packages. Call Azul today or visit azulbeauty.com.
Curious about the latest in facial rejuvenation? Join Dr. Patrick Flaharty for a free educational seminar at Azul Cosmetic Surgery and Medical Spa, discussing non-surgical facelift, laser facial rejuvenation, modern facelift, and more. This anti-aging seminar series starts at 6 p.m. on March 6th in Fort Myers, March 8th in Bonita Springs, and March 12th in Naples. Meet Dr. Flaharty and ask questions after the seminar and receive a free consultation. Reserve your seat now, 239-415-7576. AzulBeauty.com.
Welcome back to more of Look and Feel Your Best with Dr. Patrick Flaharty. I'm Gina Burch. This morning we've been talking about the concept of harmonious rejuvenation and how when you go in for surgery, we're specifically talking about surgery, even though we have mentioned how it works with the non-surgical procedures, that it makes sense just to do everything at once and tidy it all up at once. Like have a great big spring cleaning for your face, because if you leave something in the corner, you're going to see it when you come out of that, when you're all healed. And like, gosh, why didn't I take care of my eyes then? Or why didn't I take care of my jowls then? Or
yes, and it does make the most sense. And as we talked about, obviously every single case is individualized based on the patient's, goals and expectations and what they want. But you have to look at the face holistically, because there are, you don't want to create a unnatural appearance or accentuate a problem. By correcting one problem, you can make the adjacent area look worse. And so you just have to have that aesthetic concept in front of your mind as you look at a face and say, okay, what can we do?
Right.
Sometimes with patients, we'll paint the big picture of all the things that can be done, and ideally it's great if you can do them all, but not everybody can do all of them, and that's okay. So then you want to pick and choose the ones that are going to give you the most harmonious rejuvenation. So that doesn't always mean it has to be everything. It just means it has to be looked at critically to determine, okay, what are the things that are going to have the best impact, and blend together at the same time and look natural. So that's the challenge, is trying to find the best path forward for each patient.
So we've talked about the upper face, and we were on the mid face when we took a break, and we were specifically talking about the cheeks and how the problems in the mid face are typically more volume loss, and that just simply putting some filler in the cheeks will help with the crow's feet. So we've talked about how it would help with the upper part. What about the lower part? Does filling up that cheek help with some of those folds that come around the mouth and nose?
It does. When you fill the cheek, it will lift the cheek and lift the face, even tighten the jawline and reduce what we call the nasolabial fold, the fold between the corner of the mouth and the corner of the nose there, by lifting. So it helps globally. It really makes a difference. Volumizing is a really important concept. And it really helps the whole face look better. And the nice thing about volume is even if you're doing fat augmentation, it's not cutting surgery. You're just placing fat in to lift the face or fillers to lift. And so it's quite easy to do in the sense of it's not a lot of downtime with those procedures.
So let's move on then from the mid-face then to the lower, the neck, the jawline. What do you look at there as far as I need to make I'm going to say the carpet match the drapes because that's on the bottom and your eyes and your forehead on the top. So how do we make all of that work together?
So yeah, with the lower face and neck, we want to look at the skin and the shape and the degree of laxity and the fat content of the neck. So again, in the neck, that's an area where we will use liposuction to help sculpt the neck. We tend to accumulate a little extra fat in the neck as well as obviously the skin can get loose. So sculpting with liposuction can be important to try to improve the jawline and neckline. And then a thorough lifting of the lower face and neck, which is, a surgical procedure where we release the skin. We use all hidden incisions, so the incisions are inside the ear and on the back surface of the ear, so you don't see those at all. They're very delicately designed and very delicately closed, and it's all dissolvable stitches, which is great. You don't really even see those right away because they're so well hidden. Very meticulous with that. But the idea is once you've released the skin, then you can tighten the deeper layers of the face, and that's really where the action's at. The most important part is getting that deep tightening, which tightens the cheeks, jawline, and neckline. And then once you've done that deep tightening, you've reshaped the face to the desired, outcome. Then you've really just created extra skin. By tightening the lower face and neck, you create extra skin. And so then you just determine how much extra skin has been created, and you trim out that skin and then close. You're not closing under a lot of tension because it really isn't a skin tightening procedure. It's a deep tightening procedure. That's where the tension is at the deeper level, and then the skin is closed just without much tension, which allows it to heal very naturally. You don't have pulling or stretched skin or any kind of tension or minimize any tension on the skin, and the incision lines heal well that way too.
Modern facelift. I know that in the past everyone thought the facelift was tight. I got to pull that skin. Now you're going around and you look very unnatural. You look surprised, like the wind's blowing, and that's not what you do. Yeah,
over tightening of the skin can cause a stretched or the wind tunnel look, which obviously is not desirable at all. But with good technique, that's avoidable. And that's the key thing is doing the repositioning. A youthful face isn't a tight face; it's actually a soft face. It's just shaped nice. It's a heart-shaped face, with beautiful soft contours. But not tight. So it's not really a matter of trying to tighten it. You want to reshape it, and you want to reshape it without creating excessive tightness. And that's kind of the key to good procedures, is to get a nice reshaping, but have the face be soft, just as a youthful face is.
So we have gone through the three-dimensional rejuvenation. Well, we've gone through the two-dimensional. We're going to talk a little more about the third part because now my brow is lifted. I've smoothed out the forehead. I've got all of the problems with the eyes fixed. I've got possibly some volume in the cheeks, which we're going to talk more about that. We've got the loose skin and the fat out of the neck. But there's still, when you're looking at that overall, the global rejuvenation, the three-dimensional, there's that really important element that you talk about all the time, and that's the filler, the plumping it up a little now.
Yeah, so, fat augmentation is my favorite way to revolumize the face, to address that volume loss. And when you think about it, we used to do two-dimensional surgery, tightening and lifting, brow lift, face and neck lift, or eyelids. And those worked well. I mean, they make people look younger and better, but you were missing the volume part. And, we lose a lot of volume. That's one of the key changes with aging. So replacing the volume is really important to give you a more healthy, youthful, and natural result, and longer-lasting result. And in my opinion, the best way to do that is fat augmentation, where we'll just harvest a little bit of fat from your abdomen or flanks or wherever you have a little extra fat.
Then you're going to have to look hard.
Sometimes we do. Sometimes it's back of the arms and inner thighs and whatever. But
bless their heart.
But we're all fairly well insulated, so usually we can find some fat. But we harvest that fat, we spin it in a centrifuge, and then we use that concentrated fat to rebuild the face, and that will entail, upper lid and the lower part of the forehead, the temples, the lower lid, cheek, jawline, and around the mouth, including the lips. And we can do the entire face. You can do 50 or 60 cc's, so that's a lot of volume. It's not much when you're talking about harvesting from liposuction. That's a relatively small amount, so it's easy to get that. But that's a lot relative to fillers, where people might have 4 cc's of filler placed in a office visit. We're doing 50 at once, but it allows us to comprehensively address all these volume losses. And fat augmentation is really the future of revolumizing, because it is your own natural living tissue. We're harvesting it, we're spinning it down, and we're planting it into the face, where it's going to become vascularized and survive. Now, not all of the fat survives, but with our present techniques, we're getting about 70% survival on average. That means
pretty good.
It's pretty good, yeah. So a lot of the fat will survive, and that will replenish a lot of this lost fat volume. And what really happens is, when I have patients bring a photo that they like from when they were 20 or 30, or a wedding photo or a graduation photo, we use that as a template, because we're really trying to make them look like the younger version of themselves. And we will try to fully correct toward that endpoint. But you'll know you're going to always lose some fat. It could be as little as 10%, or it could be more like 30%, or even 40%, or even 50% at times. So you're going to end up undercorrected, but in general, that ends up like a really nice result, because they're softer, fuller, and more youthful, but they don't look different, because they still have the same proportionality that they had. It just gives them a little bit of a more youthful, softer version of themselves, and not looking different. And for most of our patients, that's they want to look better, they want to look healthier. They don't want to look different, and certainly they don't want to look unnatural. And so this is a really nice way to do it, which really helps to replenish some of that lost volume and give them a healthier, more youthful look. And then that fat will last many years, which is great. So it's longer lasting than fillers, because it will last for many, many years, and serve them well for that time.
And a side benefit from doing this, if you're doing multiple procedures, and if you're really going to go for it and do, like you were saying, we're gonna do it one time, we're going to have one anesthesia, we're going to have one recovery time. When you do this fat augmentation, it's really helping the healing process a little as well. There's some great benefits to it.
Yeah, it turns out that there's a lot of stem cells and growth factors in the bottom part of the, when you centrifuge fat, you concentrate a lot of those growth factor cells, and those work a magic in helping you heal better. So we do see that when we do fat augmentation with laser resurfacing, the skin heals quicker. And even when we do it without laser resurfacing, the skin a month later looks much healthier, as a result of those growth factors that are now in the tissues and helping to create healthier, newer skin. So that's a added bonus. The whole science of stem cells is still in its infancy, and we don't fully understand how that all works, but we do know there's a lot of stem cells and growth factors in that plug of fat that we centrifuge, and so those are sort of our supercharged fat cells, and we tend to use those in the areas where it's hardest to get it to retain, like the lower eyelids. So we select out the different types of fat from the centrifuge fat for the areas which we're trying to correct. Wow. And the science gets better and better,
amazing.
But it's a really fun scientific and artistic procedure. And it really makes a difference in helping people look younger in a very natural way, just reinflating the face a little bit to give them a little bit of plumpness and a little bit more of that youthful volume, right. Take away some of that hollowness and gone appearance.
One more thing before we run out of time here, and you mentioned the fractional laser resurfacing, and this would be one of the final elements if you're going to do that harmonious rejuvenation while you're under anesthesia and while you're in the operating room.
Yeah, so the great benefit is in the past, the lasers were too aggressive to really do with facelifts, but now because we have fractional technology and we can deliver the laser at very light energies, we can resurface at the same time and do it in a very safe way, and again, still have everything healing in 10 days to 2 weeks. So that's been a huge advantage. We don't have to now separate that as now another procedure to come back for 6 months later or a year later. You can do it all at once and have everything healed. So that's wonderful. Like I said, it just gets better and better every year.
Right. And you're right. Then my skin looks just as good on the outside as it is tight and everything on the inside. It's been a great show. Thank you for explaining once again in detail the Harmonious three-dimensional rejuvenation and how it works and why it's so important in your practice here.
Yeah, it's really the state of the art, and it's now all achievable in, a single procedure, which is really exciting. We didn't do this 20 years ago,
Right.
And now we have this great capacity to really get this full rejuvenation and still only 2 weeks of downtime. So.
Dr. Flaherty's new book is called Young Again. You can get it on Amazon. You can also find it at the Azul Cosmetic Surgery and Medical Spas in Fort Myers, Naples, and Bonita. You can give them a call on Monday if you want and set up a consultation at 239-415-7576 or online at azulbeauty.com. Thanks. Good to see you this morning.
Thanks, Gina. Have a great weekend.
I will, and we'll be back next week with more of Look and Feel Your Best. For Dr. Patrick Flaherty, I'm Gina Burch.
Curious about the latest in facial rejuvenation? Join Dr. Patrick Flaherty for a free educational seminar at Azul Cosmetic Surgery and Medical Spa, discussing non-surgical facelift, laser facial rejuvenation, modern facelift, and more. This anti-aging seminar series starts at 6 p.m. on March 6th in Fort Myers, March 8th in Bonita Springs, and March 12th in Naples. Meet Dr. Flaherty and ask questions after the seminar and receive a free consultation. Reserve your seat now, 239-415-7576, azulbeauty.com.